Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and I am here today with my non-flyaway hair co-host, Dr. Millicent Rovelo. How are you doing?
Good. I need like a whole team to keep my hair down.
So maybe those of you watching us live on Instagram see us doing the hair check because there's a wisp of hair of Dr. Rovelo's that just kind of does its own thing.
It's the same piece every time.
Yep, behind the headphones, there's just something that wants, I think it just wants to express itself.
It does. My hair just does it. I have zero control over it. It does what it does. It's good. It's bad. It's whatever. But it's that piece. That's my piece.
And that is not photoshopped into the photo or the video.
Ooh, way to intro this one. Okay, Dr. Calvert, I know I usually tamper you down and hold you in check on your rants, or I try to.
You do.
But I am giving you carte blanche today to say your piece, because you let me say my piece on our last podcast. So this is your turn to talk about what I know gets you equally hot and bothered.
Yeah.
Yeah. Well, let's talk about where this started.
Yeah.
Yeah.
I'm going to have to go ahead and disagree with that because hot and bothered is probably the understatement of the day. It's a little shout out to the Office Space people there. I don't want to rant. I don't want to rant. I want to be zen, calm, cool, and collected.
Let's
because
see how
this is about patient information. This is about people getting the information they need to make a decision for surgery for themselves. And the problem that I'm having right now is that the information is being played with. It's being distorted.
It's being filtered, you might say.
It's being filtered. It's being fussed with. It's being twisted. It's being
manipulated.
It's just, it's awful. And I'm not going to, I want to start back a long time ago when I was in New York at the ASAPS meeting then, which has now become the Aesthetic Society, at the Javits Center. And I was sitting with a friend of mine from the tri-state area. I won't even name names, which state. And he goes, your results on your website are pretty good. How much of those are photoshopped? And I was like, excuse me? None. What kind of question is that? He kind of looked like startled and surprised. I was just like, and he was like, no, it's just, like kind of like, if he could have taken it back and done like, just like total like rewind. And he was embarrassed because I quickly knew that his were photoshopped.
Clearly.
I don't Photoshop my before and afters ever. They are shitty medical photos taken in my office with, unfortunately, the lighting isn't always the same or perfect. I get it. Everyone's like, the lighting in this one. I'm like, yeah, fine. But it's still shot with the same, straightforward Canon camera, or they're shot on my iPhone, but they are unfiltered, undoctored, unanythinged medical photos. Which they should be.
And that's sort of how, doctors have been trained, plastic surgeons, we've been trained, when you're coming out, like that's sort of part of our code of ethics. Is like, you don't Photoshop.
You don't do that.
Your photos. Like this is your work, and it's a misrepresentation if you do anything else to it other than standardized medical photos. Because when we go and we take our boards, we have to present standard medical photos of the work we did in order to pass our boards. So it's a very standardized thing. We take classes on how to take medical photographs because we believe it's that important to have a standardized set of results to show to our peers, to show at lectures, to show at meetings, to show to potential patients. So let's rewind and get back to...
I feel my blood pressure going up, so I'm going to just, I don't want to have like... I don't want to have a stroke right now, so I just want to just take it easy.
Take it easy.
I'm going to be fine.
Let's talk about the story that got us to this podcast. So the story that was circling around on the Daily Mail recently was in reference to a post that was put out on Instagram from an account called The Beauty Broker. And she posted this before and after result of a facelift patient. Patient had had brow lift, quad bleph, and a facelift. And the results were phenomenal. I mean, the guy,
Best I've ever seen.
everyone's like, oh my gosh, he looks like his 30-year-old version of himself. This is amazing. This is amazing, awesome, awesome results. Like people were like going bananas over the results. And then people all started, commenting and throwing out questions like, wait a second, this is too good. Like, has this been Photoshopped? Has this been AI'd? Like, let's put on, there's some, software program you can put it through, or it looks to see if anything's been Photoshopped, and the whole thing lit up green, which means the whole thing was Photoshopped. And so then it became a whole phenomenon based on that. Like, oh, shocking. This amazing, incredible, unbelievable result is actually unbelievable.
So, and by the way, like a lot of the boards and a lot of the countries where these results, show up are, they don't have the code of ethics that we do.
No.
They don't. So like, once again, we're boxing with one arm tied behind our back in terms of competition for aesthetic patients, because we're busy showing like the real results. And like what I do now a lot is I show videos of patients with me standing next to them so they can see the result. Like it's not.
Well, that's what I thought.
Yeah.
Then I found out you can edit videos. My mind was blown when I realized you could filter videos.
Oh yeah, well one of the guys on our street does that, and it's so funny because I said that to one potential patient. I was like, yeah, there's a guy on this street on Roxbury that if you look at his video reveals, his face is totally twisted. And she went and named the surgeon that fast. And she was like, oh, I know who that is. I got it. I know who that is. She knew exactly who I was talking about because if you look, his face is all like twisted, and because the filter is focused on the subject, which is the patient, and he's in the background smiling and showing like, doing like, some like very creepy dance in the background. And it's weird, number one, but number two, you can see that he looks very distorted. So it gives away the filter. So you can, if the eyes cannot see what the mind does not know. Rod Rourke says it all the time in his talks. It's very true. If you don't know what you're looking for, you can't see it. But if you maybe we should like do like a little like, here, let's look at this one. I mean, unfortunately, these people like are very close to me and friends and things that I'm just like, maybe you should stop with the filters. But even more trickery that we see are, the before and afters where, the before is a medical before and the after is a patient selfie with filters, full hair and makeup, sunshine on their face, and like, look at this amazing before and after. Look at how great my patient looks. It's like, you didn't need to do surgery to do that. I mean, I always bring up not even that. I bring up the example of one where the patient before has glasses on. It's a medical before, no makeup. Hair, is just down like a wet dog, and the after is full hair, full makeup, glasses off, smiling ear to ear. You don't need to have surgery to get that result. You just need to do the photographic trickery that's being used to show these results. And the comment from the surgeon on that one is like, wow, what a transformation. I was like, great, you took off the glasses, hair, and makeup. Did you operate? Because you don't need to get that result. Yeah. It's not a result. So it does drive me crazy because there is no recourse for that surgeon. There is no recourse for a photoshopped before and after. Is the one on in the Daily Mail photoshopped? Who knows? I don't know. Maybe there is some surgeon who can do that. I don't call into question if somebody's going to stake their claim on it that it's not photoshopped. Here's what happens though. Let's say you go to that surgeon and you get a crappy result, and it's like, well, I came in because of this. It takes one smart lawyer to say, these results are photoshopped. Give me the original photos. They file a lawsuit. You go through discovery, and guess what? You're outed. And now what?
Yeah.
Now every patient that came because of your wonderful before and afters, and by the way, I am giving this idea to some lawyer. I'm sure right now they're going like, wait, let me write this down.
Wait a second.
How do I do this?
So I deposit.
So what do I have to do again? Tell me, Dr. Calvert, because like you're then sitting there with, false advertising, and you're advertising results that aren't real. And, like I said, I don't know whether that result is real or not, but I love to talk about it because I see stuff and I'm not even looking for it. And it leaps out of the screen of my phone. It's like a hand comes out and slaps me in the face and says, "Can't you do anything about this?" And it's like, no, what am I going to do?
Yeah. And I think that's just, this is the era we are living in, where with the advent of social media and filters, it's so easy to just, I know I do it. I'm looking at a photo or something of myself. I'm like, oh, I don't like how that looks. Like, oh, change that. Oh, look, it looks so much prettier. Like we've gotten so used to just changing things we don't like about our appearance that it's an easy transition. Oh, I don't like that result. Let me just okay, that's better. And I almost wonder if the patients themselves really care, or if they just expect and assume that that's not a real result. I don't know the answer for that. I'm interested in what you said about how other countries do it differently, because I was working with a friend of mine, and she was talking about like promoting befores and afters and this and that, and she comes from a foreign country, and she's like, well, just send me all your photos or whatever, and she was like, but these are the photoshopped ones, right? And I was like, huh? She's like, well, you photoshopped them before you send them to me, right? And I was like, no, we're not allowed to do that. And her mouth dropped. She's like, oh, really? Because everything else that we do where I come from, we always Photoshop them before I put them up. Look at this patient. See how much tinier her waist is than it really is? And I was like, no, you can't do that. But it didn't occur to her to not Photoshop results.
I'm sorry, that's bad manners. It's just bad manners. That's all there is to that. I can't say it any other way, because you don't do that. I would just feel like I was like lying to my patients out of the gates. Like it's like,
I think people think of it as marketing, and we all know that advertising and marketing is mostly lies. And so they're not coming at it from a, ethical, moral, I'm a doctor, I do good standpoint. They're coming at it from a, hey, I'm here to make money and market and advertise, and half of advertisement is lies. So why would this be any different? It's two different ways of looking at the same practice.
I was back at the University of Pittsburgh this weekend past to give a course on rhinoplasty, and I talked about before and afters, and I talked about this a lot, and and we had a big discussion about social media, and I just said, look, your social media should reflect who you are as a surgeon, as a doctor. It should reflect, there should be some fun stuff about you, but it mostly should be educational about what you do, and you need to get real with your patient population. You need to, kind of bare your soul of who you are so that they can see whether they want to come to you as a surgeon. And I think one of the most satisfying things about the way that I think, and you do it the same way I do, we do it from an educational standpoint, and they see who we are. I mean, this podcast is who we are. Yeah. Like, this is our marketing. If anybody wanted to know why we do this podcast, it is marketing. It's like, this is who we are. We can't sit here. We have no script. We barely knew what we were going to talk about when we walked in here today. There's a Daily Mail article. Let's talk about this. But then what happens is then your patients can make a real decision. They can decide, I don't want that. I want the glitz glam, and I want, fountains in the waiting room, and, I want, whatever that they're looking for. Yeah. Whatever you want, get it. I believe you, because I get the patients that are right for me. I get patients, that fly in from all parts of this country. They say, I just really wanted to know that I was giving myself the best shot to get the best result possible. I know surgery has risk. These are like quotes from my patients, and they sound like people that I would hang out with, because they're like, I need to stack the cards. I know it's expensive here, but I just feel like at least I've given myself the best shot, and that's based on information that I've provided, to the public for what it is that I do and how I do it, and that's fair. When it's a frickin', bag full of cow dung that they're giving you, and polishing it up and putting, flowers on it and putting it in a picture frame but wait, no, it's really great. It really is. It's upsetting, and to me, it's just not fair.
So then, how are patients ever going to know what is real and what's not? Because if you're putting up photoshopped or filtered befores and afters, literally, how are they going to know what's real? This is the problem. Now we're getting philosophical. This is the problem with our society these days. Is we just don't know what's real at all anymore and what's fake news.
Well, that's why you have to know the person, or you have to know the referral source. It's referral source. It's referral source.
Again,
it is.
Gosh, why couldn't I have been a plastic surgeon in the 90s or 2000s when you lived and died by your referral base, and you built up your practice slowly, and as you got more skilled and established and your abilities grew, so did your referrals, like in tandem. You weren't like a flash in the pan right out of the gates, shiny and glittery, but with nothing to back it up.
Right. And
so if you're really thinking about it, and maybe you have a short list of doctors you've researched and looked up, if you know somebody that's been to them, or you personally have a connection, like that's really the best place. Or ask another doctor maybe who might know about them. Like, try and get some more first or secondhand knowledge as a backup to what you might be seeing.
Yeah, 100%. It is all about that. And obviously board certification counts. I don't want to throw one of my buddies under the bus, but like he had a post up the other day that was like, oh, you need to go to a facial plastic surgeon to, get a rhinoplasty or facelift. And then he like went on a rant about quote unquote general plastic surgeons. And I was just like, are you kidding me? Are you kidding me? You who know me and others like me that we are friends of yours that do really good work.
Yeah.
You're going to tell the public that you need to have a facial plastic surgeon? I mean, let's get into the differences between the two. Like, why would you do that? First of all, I understand that, everybody wants to get all the cosmetic surgery that they possibly can because it pays the bills and blah, 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 blah. But let's talk about it for a second. Plastic surgeons are certified by the American Board of Plastic Surgery, which is an ABMS board. It's recognized by the American Board of Medical Specialties. Facial plastic surgery is not. It is a board, and they have rigorous, credentials and all that. And lots of facial plastic surgeons are really good at rhinoplasty and really good at doing facelifts and good at fat grafting and lip lifts and all that stuff. And they're great. But to say that there's an inferiority problem in plastic surgery, I mean, come on now.
So a facial plastic surgeon, for the uninitiated, is an ENT doctor who did a 1-year fellowship in facial plastics.
Correct.
So just to explain the differences. I mean, you can do a 1-year fellowship in facial plastics out of plastic surgery as well. But that's how you're considered a facial plastic surgeon or a board certified facial plastic surgeon. Usually you come through an ENT background as opposed to a 6 or 8 year plastic surgery program.
Right. And I don't think there's much difference at all if you focus on these things. But for somebody to say you should not be going to these folks and you should be going to us based on our training. Like, we trained for 6 years in plastic surgery. Like, we don't spend 2.5 years drilling the temporal bone and, doing pediatric allergy and all these other things that you do in an ENT residency. You really don't get to aesthetic surgery in ENT until you do your 1 year of facial plastic surgery, which is great.
Which is fine.
It's fine.
It's enough training.
Awesome.
It's great.
Good on you.
Yeah.
But you can't look back at me and say, you shouldn't be doing this.
Right.
It chapped my hide. That's what it did. And I was just like, are you really saying this? And it's still up, and it's, I haven't taken it down, but I was like, he said, I'm sorry this offended you. I was like, offended? It's like the stupidest thing I've ever heard you say, from a really smart guy. And so it pissed me off to no end. And I just was like, no, I am not letting that go. And I don't want to get into the differences of who's better, because it isn't, you don't measure it that way. You measure it by results. And that's the truth. So if you're upset that you're not getting enough patients, it's probably that your results aren't good enough. Number one. Number two, it's probably because you haven't put yourself out and marketed yourself anymore, because you have to do that today. You're not going to get referrals from the guy that knows you from the hospital OR lounge. It doesn't happen.
Not anymore.
So I say to the guy that says, oh, we're better than you, I have to puff my chest out and point at you and say, you're worse. Read the Sneetches on the Beaches and you'll learn exactly what happens from Dr. Seuss. And then also the other thing is get better at what you're doing. Like, get better results because people will come if you're good at it.
If you're good at it and you post the real results, which is what we've been trying to hammer home.
Did I just go off on a rant?
You did go off on a rant.
I think I did.
I'm trying to tie it back in. I'm trying to sneak that back in.
But boy, just like I'm sitting there talking to these residents and like as I'm explaining what happened, like all of a sudden, like, I start to feel like a little smoke coming out of my ears as I'm talking to them, and they could see, and they I think they got a little scared for a minute, but it's not right. You don't point fingers. Plastic surgeons can do facelifts and rhinoplasty. We're pretty dang good at it, and those of us who focus on it, we're really good at it. So don't say like, oh, don't go to them because of their certification. Like that's really awful.
Yeah, but you do also have to be a board certified. So I'm just trying to keep it clear for the people. Because we just said go to a board certified plastic surgeon.
I understand, but you can go to a board certified facial. I have loads of facial plastic surgery friends. They are my friends. This one I'm not so sure anymore, but we'll have a chit chat when we run into each other at a meeting. But the other ones, yeah, I mean, and they're really good at it, and we share information because that's how you get better at surgery. That's how you make it better for your patients, right?
Mm-hmm. Yes.
Do you want me to bring it back around? I know you do. I see that. Should I come back from left field? Did I go to left field? All right, I'll bring it back home. In any event, just be careful with all the marketing BS that's out there. Read that Daily Mail article. It's really good. Mm-hmm. If that's a real result, good on that surgeon, man.
Fantastic.
Tell me where he is. I'm getting my facelift there.
Seriously.
That's for sure. For sure. But if it's photoshopped, then I think that's going to be a problem at some point. At some point, this stuff will come home to roost.
Well, it's good that you just educated and didn't go on a rant on this podcast.
No, I did. That's all I wanted to do. Like I thought my visit to the University of Pittsburgh would be a rant-free zone, but it wasn't. I just
can't be helped.
No, it's just. Look, I'm an emotional guy. I'm very passionate about what I do, and I don't like people attacking me.
I told you I'd give you this one, so it's all you got it.
Thank you. In that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.